Recurrent respiratory infections can play a significant role in lung health, sometimes contributing to serious conditions like lung cancer.
The infections and the causation of cancer, that is the question. So the recurrent infections can cause lung cancer in different ways. Actually, sometimes it may not be causing directly the cancer, but some infections like chlamydia, some bacterial infections, specific bacterial infection, they can have a causal association with the lung cancer. There are studies showing that. So all the infections cannot produce lung cancer, but some infections are peculiar to produce to cause lung cancer in long term. That is the one direct association, and there are some indirect association between the lung cancer and respiratory infection. So the patients who are getting recurrent lung infection, they are the people who had some lung damage, probably due to some smoking or this COPD, like chronic obstructive pulmonary disease, again related to smoking to a large extent. They are all prone for recurrent respiratory infection. So in those patients who had already had a damaged lung due to smoking, and getting recurrent respiratory infection can add on to the causation of lung cancer. So there are direct and indirect associations between recurrent respiratory infections and lung cancer.
Pneumonia and tuberculosis are common respiratory conditions, but their connection to lung cancer is a subject of ongoing study.
So the pneumonia is a blanket term used for the infections mainly infections in the lung. Okay. So so that is known as the pneumonia among the general population. So pneumonia, just once in a lifetime, we all may get pneumonia, and that may not be a big cause for this lung cancer, but some specific rare type of pneumonia, that is, I already told, like a chlamydia, it is a bacteria that can in long term, there are some studies, it can produce this lung cancer. And coming to tuberculosis per se, it cannot produce a high incidence of lung cancer. The India is known as a capital of tuberculosis, but per se, we cannot tell that the tuberculosis is producing lung cancer. But tuberculosis has certain predictions, like a poor atmospheric condition, poor hygiene, your respiratory habits like the smoking, use of tobacco, and all. They are all more in our country, so we are more prone for tuberculosis. The same causative factors can produce lung cancer. So tuberculosis itself has a minor role in the production of lung cancer, but the common environment we are sharing have a predilection for both tuberculosis and lung cancer.
Advancements in lung cancer treatment over the past 2 decades have transformed patient care and outcomes, offering hope even in advanced stages.
Yeah, the treatment of lung cancer is having a lot of progress in the last decade or last 20 years, as 2 decades probably. So a lot of advancements are coming. That lung cancer is a prime example where the newer drugs and all producing a lot of change in the patient faith, actually. So we can see that there are two types of lung cancer: small cell and non-small cell. And among the non-small cell lung cancer, and all the types of lung cancer we usually see in a very advanced stage. Most of them will be coming in a non-curable stage, like stage 4. I think it is around 75% maybe in a non-curable fashion we are getting. So with those patients, when they are coming to us in the higher stage, also we are having a lot of newer drugs that is especially applicable to those patients who are non-smokers and ladies who are less exposed to tobacco and all. They are having a lot of targets inside their tumor, and we can target with the newer tablets like targeted therapy tablets, as well as immunotherapy is another advent. This is applicable to both smokers and non-smokers. Previously it was only chemotherapy where we were giving the chemotherapy and the patient will be exhausted soon. But nowadays, majority we cannot call that, but a very good proportion of lung cancer patients are getting a good survival with the advent of newer drugs and newer modalities of treatment.